I'm Alan Dale from Gale Force Winds. I want to tell you, so much fun here at the Big Raise, raising money for the Healthcare Foundation of Newfoundland and Labrador, right here in a beautiful Jag Hotel. People having a lot of fun, great camaraderie, great food, a lot of people leaning into raising money. Why don't you introduce yourself? Tell us where the Healthcare Foundation and you come together.
Well, I'm chair of the board of the Healthcare Foundation. I've been on the board now for 10 years. I've been chair for 4 years, and I'm very passionate about healthcare. And in my case, at least, I wanted to pick an area from a volunteer standpoint that I felt like I could make a difference. So I looked at it. I said, you know what, it's healthcare for me. So I've been very passionate and very engaged for a long time now. And on a night like this, it actually really, you feel really good. Hey, as a volunteer, kind of trying to give back to the community, make a difference. Makes a big difference for me.
What was it about healthcare that drew you in?
Well, I think if I'm being really, really frank, I'm going to say the opportunity was amazing. The need was high. We just needed volunteers to kind of come together and make a difference. So it wasn't easy. But I picked healthcare, and there's a lot of other great areas too that I'm involved in to some degree as well. But this is my big area of kind of give back, and I just feel like Newfoundland Labrador, which is incredibly important to me and has been for my whole career, we have to get healthcare right if we're going to continue to build and grow as a province. So in my mind, healthcare was the obvious choice, and I'm really happy, very satisfied actually.
In your role, of course, you would get the great privilege of meeting many of the frontline workers, people that truly benefit from all the work that's being done here tonight. Talk to me about what those people mean to you.
Well, you are right. So I get a lot of opportunities to kind of represent healthcare. And I'm speaking with physicians all the time, frontline employees working in healthcare in Newfoundland and Labrador, and just to see how passionate and driven they are. And look, it's not easy. We know this, right? It's not easy. We've had a really, really challenging period of time. But when I hear the stories about how hard people are working, the difference we're making, it certainly makes me feel really good. But I do get an opportunity to get up close and personal with patients for sure, certainly with frontline workers for sure, physicians for sure. And everybody's really putting a big effort in here, and it makes me feel really good. It really does, yeah.
Stay on the patient thing for a minute, because of course the physicians, the healthcare workers, those frontline workers, where all of this is going to support, the end result is patients get the benefit of all of this.
No question about it.
You must see stories that transform your life of what the work you're doing supporting those patients. Tell me about that.
Well, first of all, in a lot of cases, the great stories don't come out, right? The really good stories oftentimes don't come out. But when you're talking to someone who's gone into a hospital, had the right operation, it was a grandparent, it was a parent, and they've had a good result, that makes me feel really good. So, and that's why we're all here. And there's so many great stories like that should make us all feel good about the fact, you know what? We got to keep going. We got to keep working hard. Try to stay positive. Keep raising the money that we need. Get the equipment that we need, like we've been talking about here today with like Da Vinci robotics. So get the equipment that we need to get the physicians here to make a difference. So I believe in staying positive too. I believe in staying upbeat, and we are making progress. It's not easy. There's lots of work left to be done. But when you can see a difference that we're making on the front lines with the employees and the people that are working, and the patients that are getting outcomes makes me feel really good.
And a special way to do it here, with a little bit of fun along the way, right?
No,
talk about your love for Newfoundland and Labrador. Well, this speaks to it right here. Everybody having a good time for a good cause.
Well, you come to an event like this, and you come to a venue like this too, right? Where it may say, everybody in this room tonight is here for the right reasons. They're here to have a little bit of fun and make some connections, but everybody's here to help raise money for healthcare in Newfoundland and Labrador. And people are having fun here tonight, making friends. But at the end of the day, it's all about doing what's right for healthcare in Newfoundland and Labrador. And I couldn't be more proud of my role, and certainly the role that we're all playing actually in this.
Thanks very much for what you do. We certainly appreciate it. Good luck at the table. I hope you lose a lot of money.
I'm going to need it. Yeah. Okay. Good man. Thank you very much. Appreciate it. Yeah.